I've been coming to the American Heart Association and been involved for literally decades. And the Heart Association means so much to so many people. So specifically, as a physician, as someone working in healthcare, I look to the American Heart Association as a trusted source of information. And that's all backed up by the American Heart Association being founded on research and truly bringing all the science to life. So, what I see is over the decades that I have practiced as a cardiothoracic surgeon, a heart surgeon, I have seen the benefit for my patients based on research that gets presented at sessions here. So, decades ago, we used to care for patients who would have heart attacks that weren't diagnosed immediately, that weren't treated immediately, and then they'd have consequences of those heart attacks, really severe problems, such as disruption of the heart wall, uh, immediate acute disruption of a valve functioning. So the difference is today, what I see is that heart attacks are recognized more readily, more easily, and treatment is initiated immediately. So we have Get With the Guidelines, and that provides every provider, every hospital that participates with Get With the Guidelines, it provides them the best treatment for a patient presenting with acute heart attacks. So we're able to stop that heart attack before they even get to the cath lab. We're able to start treatment and do things to improve their lives. So all these terrible complications that we used to see decades ago from a heart attack, we don't see them now because we are able to identify a heart attack in the ambulance before the patient ever gets to a hospital and to initiate treatment. So what I see is that the American Heart Association brings all of us along learning new ways of treating patients, and it's based in research. So sessions is the way everyone comes together from not just around the country, from around the world to show their research, show what they've discovered, and that forms the basis for our guidelines and the practices that we bring back to our communities, not just in big cities, but back to our small towns, back into rural areas. And I see that it has changed and improved the lives of individual patients every day.